A chest X-ray report for a client indicates the presence of a left apical pneumothorax. The nurse would assess the status of breath sounds in that area by placing the stethoscope in which location? 1. Just under the left clavicle. 2. Midsternum, 1 inch to the left. 3. Over the 5th intercostal space. 4. Midsternum, 1 inch to the right. Answer: 1. Just under the left clavicle. Rationale: the apex of the lung is the rounded, uppermost part of the lung. Therefore, the nurse would place the stethoscope just under the left clavicle. All of the other options are incorrect locations for assessing the left apex. 2. The nurse is assisting a radiologist to facilitate a thoracentesis. The nurse assists the client to a position that widens the spaces between the ribs to help drain which area? 1. Alveoli. 2. Trachea. 3. Pleural space. 4. Main bronchi. Answer: 3. Pleural space. Rationale: thoracentesis is the needle aspiration of fluid or air from the pleural space for diagnostic or management purposes. Thoracentesis may be done at the bedside and is often done with imaging for guidance. The other options are incorrect. 3. A client receiving total parenteral nutrition (TPN) is demonstrating signs and symptoms of an air embolism. What is the first action by the nurse? 1. Stop the TPN solution. 2. Place the client in the high Fowler's position. 3. Notify the primary healthcare provider (PHCP). 4. Place the client on the left side in the Trendelenburg's position. Answer: 1. Stop the TPN solution. Rationale: although stopping the TPN solution will not treat the problem, it will prevent it from worsening and is a quick action that can be completed first. Lying on the left side may prevent air from flowing into the pulmonary veins. Trendelenburg's position increases intrathoracic pressure, which decreases the amount of blood pulled into the vena cava during inspiration. The high Fowler's position is not helpful at this time. The PHCP should be notified, but this is not the first action. 4. The nurse is collecting data from a client. Which symptom described by the client is characteristic of an early symptom of benign prostatic hyperplasia? 1. Nocturia. 2. Scrotal edema. 3. Occasional constipation. 4. Decreased force in the stream of urine. Answer: 4. Decreased force in the stream of urine. Rationale: decreased force in the stream of urine is an early symptom of benign prostatic hyperplasia. The stream later becomes weak and dribbling. The client then may develop hematuria, frequency, urgency, urge incontinence, and nocturia. If untreated, complete obstruction and urinary retention can occur. Constipation or scrotal edema is not associated with benign prostatic hyperplasia. 5. The nurse has provided discharge instructions to the client who has had a pneumonectomy. Which statement, if made by the client, indicates an understanding of appropriate home care measures? 1. I should restrict my fluid intake for 2 weeks. 2. I should perform arm exercises 2 or 3 times a day. 3. If I experience any soreness in my chest or shoulder, I should notify the primary healthcare provider. 4. If I experience any numbness or altered sensation around the incision, I should contact the primary healthcare provider. Answer: 2. I should perform arm exercises 2 or 3 times a day. Rationale: the client should be instructed to perform arm and shoulder exercises 2 or 3 times a day to prevent frozen shoulder. The client is encouraged to drink liquids to liquefy secretions, making them easier to expectorate. The client is told to expect soreness in the chest and shoulder and an altered feeling of sensation around the incision site for several weeks. It is not necessary to contact the primary healthcare provider if these symptoms occur. 6. A client receiving total parenteral nutrition (TPN) experiences sudden development of chest pain, dyspnea, tachycardia, cyanosis, and a decreased level of consciousness. What should the nurse suspect as a complication of the TPN? 1. Air embolism. 2. Hyperglycemia. 3. Catheter-related sepsis. 4. Allergic reaction to the catheter. Answer. 1. Air embolism. Rationale. Signs and symptoms of air embolism include decreased level of consciousness, tachycardia, dyspnea, anxiety, feelings of impending doom, chest pain, cyanosis, and hypotension. The signs and symptoms in the question do not indicate hyperglycemia, an infection, catheter-related sepsis, or an allergic reaction. 7. The nurse is performing an admission assessment on a client with tuberculosis, TB, and is collecting subjective and objective data. Which finding would the nurse expect to note? 1. High fever. 2. Flushed skin. 3. Complaints of weight gain. 4. Complaints of night sweats. Answer. 4. Complaints of night sweats. Rationale. The client with TB usually experiences a low-grade fever, weight loss, pallor, chills, and night sweats. The client also will complain of anorexia and fatigue. Pulmonary symptoms include a cough that is productive of a scant amount of mucoid sputum. Purulent, blood-stained sputum is present if cavitation occurs. Dyspnea and chest pain occur late in the disease. 8. The nurse is caring for a client admitted for a fractured hip status post-fall at home. On assessment of the client's affected lower extremity, which signs, symptoms would most likely be noted? 1. Shortening and abduction. 2. Abduction and internal rotation. 3. Shortening and internal rotation. 4. Shortening and external rotation. Answer. 4. Shortening and external rotation. Rationale. Signs of a hip fracture include shortening and deformity. The affected leg externally rotates as a result of discontinuation of the femur and loss of alignment and muscle control. The remaining options are not findings associated with a fractured hip. 9. A client with medullary carcinoma of the thyroid has an excess function of the C cells of the thyroid gland. When reviewing the most recent laboratory results, the nurse should expect which electrolyte abnormality? 1. Sodium. 2. Calcium. 3. Potassium. 4. Magnesium. Answer. 2. Calcium. Rationale. The C cells of the thyroid gland are helpful in maintaining normal plasma calcium levels. They do not affect the levels of sodium, potassium, or magnesium. 10. A client has had an invasive abdominal surgery to relieve an obstruction of the common bile duct. The client's surgery is completed, and the client has been transferred to the post-anesthesia care unit, PACU. The PACU nurse observes that the client suddenly appears red in the face and appears to be coughing despite the presence of an endotracheal tube and ventilator support. What action should the PACU nurse take first? 1. Suction the client through the endotracheal tube. 2. Instruct the client in the use of an incentive spirometer. 3. Turn the client from a 30-degree lateral position to a supine position. 4. Instruct the client to use a communication board to tell the nurse what is wrong. Answer. 1. Suction the client through the endotracheal tube. Rationale. The client is choking on his secretions, which should be removed by suctioning the endotracheal tube. The client is unable to use an incentive spirometer while an endotracheal tube is in place. The client's inability to breathe impairs ability to learn how to use a communication board. Turning the client assists in clearing his airway, but a supine position will worsen the airway problem. Suctioning the client is the best nursing intervention because it will have the most immediate effect. 11. A client has been diagnosed with pheochromocytoma. Which clinical manifestation is most indicative of this condition? 1. Water loss. 2. Bradycardia. 3. Hypertension. 4. Decreased cardiac output. Answer. 3. Hypertension. Rationale. The client with pheochromocytoma has a benign or malignant tumor in the adrenal medulla. Because the medulla secretes epinephrine and norepinephrine, the client will exhibit signs related to excesses of these catecholamines, including tachycardia, increased cardiac output, and increased blood pressure. Vasoconstriction of the renal arteries triggers the renin-angiotensin system, resulting in water reabsorption and retention. 12. A client is suspected of having systemic lupus erythematosus, SLE. On reviewing the client's record, the nurse should expect to note documentation of which characteristic sign of SLE. 1. Fever. 2. Fatigue. 3. Skin lesions. 4. Elevated red blood cell count. Answer. 3. Skin lesions. Rationale. Systemic lupus erythematosus is a chronic, progressive, inflammatory connective tissue disorder that can cause major body organs and systems to fail. The major skin manifestation of SLE is a dry, scaly, raised rash on the face known as the butterfly rash. Fever and fatigue may occur before and during exacerbation, but these signs and symptoms are vague. Anemia is most likely to occur in SLE. 13. The client with pheochromocytoma is scheduled for surgery and says to the nurse, "I'm not sure that surgery is the best thing to do." Which statement is the appropriate response by the nurse? 1. There is no reason to worry. Your surgeon is wonderful. 2. I think you are making the right decision to have the surgery. 3. You are very ill. Your surgeon has made the correct decision. 4. You have concerns about the surgical treatment for your condition? Answer. 4. You have concerns about the surgical treatment for your condition? Rationale. Paraphrasing is restating the client's messages in the nurse's own words. The correct option addresses the therapeutic communication technique of paraphrasing. Telling the client that there is no reason to worry is offering a false reassurance. And this type of response will block communication. Telling the client that the surgeon has made the correct decision also represents a communication block in that it reflects a lack of the client's right to an opinion. In the remaining option, the nurse is expressing approval, which can be harmful to the nurse-client relationship. 14. A 55-year-old male client confides in the nurse that he is concerned about his sexual function. What is the nurse's best response? 1. How often do you have sexual relations? 2. Please share with me more about your concerns. 3. You are still young and have nothing to be concerned about. 4. You should not have a decline in testosterone until you are in your 80s. Answer. 2. Please share with me more about your concerns. Rationale. The nurse needs to establish trust when discussing sexual relationships with men. The nurse should open the conversation with broad statements to determine the true nature of the client's concerns. The frequency of intercourse is not a relevant first question to establish trust. Testosterone declines with the aging process. 15. The client reports to the nurse that while performing testicular self-examination, he found a lump the size and shape of a pea. Which statement is the most appropriate response to the client? 1. Lumps like that are normal. Don't worry. 2. Let me know if it gets bigger next month. 3. That's important to report even though it might not be serious. 4. That could be cancer. I'll ask the primary healthcare provider to examine you. Answer. 3. That's important to report even though it might not be serious. Rationale. Testicular cancer almost always occurs in only one testicle and is usually a pea-size, painless lump when discovered. The cancer is highly curable if found early. The findings should be reported to the primary healthcare provider. 16. A client is brought to the emergency department in an unresponsive state, and a diagnosis of hyperosmolar hyperglycemic syndrome is made. The nurse would immediately prepare to initiate which anticipated primary healthcare provider's prescription? 1. Endotracheal intubation. 2. 100 units of NPH insulin. 3. Intravenous infusion of normal saline. 4. Intravenous infusion of sodium bicarbonate. Answer. 3. Intravenous infusion of normal saline. Rationale. The primary goal of treatment in hyperosmolar hyperglycemic syndrome, HHS, is to rehydrate the client to restore fluid volume and to correct electrolyte deficiency. Intravenous, IV, fluid replacement is similar to that administered in diabetic ketoacidosis, DKA, and begins with IV infusion of normal saline. Regular insulin, not NPH insulin, would be administered. The use of sodium bicarbonate to correct acidosis is avoided because it can precipitate a further drop in serum potassium levels. Intubation and mechanical ventilation are not required to treat HHS. 17. A client with a diagnosis of diabetic ketoacidosis, DKA, is being treated in the emergency department. Which findings support this diagnosis? Select all that apply. 1. Increase in pH. 2. Comatose state. 3. Deep, rapid breathing. 4. Decreased urine output. 5. Elevated blood glucose level. Answer. 2. Comatose state. 3. Deep, rapid breathing. 5. Elevated blood glucose level. Rationale. Because of the profound deficiency of insulin associated with DKA. Glucose cannot be used for energy and the body breaks down fat as a secondary source of energy. Ketones, which are acid byproducts of fat metabolism, build up, and the client experiences a metabolic ketoacidosis. High serum glucose contributes to an osmotic diuresis and the client becomes severely dehydrated. If untreated, the client will become comatose due to severe dehydration, acidosis, and electrolyte imbalance. Kussmaul's respirations, the deep rapid breathing associated with DKA, is a compensatory mechanism by the body. The body attempts to correct the acidotic state by blowing off carbon dioxide, CO2, which is an acid. In the absence of insulin, the client will experience severe hyperglycemia. Option 1 is incorrect, because in acidosis the pH would be low. Option 4 is incorrect because a high serum glucose will result in an osmotic diuresis and the client will experience polyuria. 18. The nurse teaches a client with diabetes mellitus about differentiating between hypoglycemia and ketoacidosis. The client demonstrates an understanding of the teaching by stating that a form of glucose should be taken if which symptoms develop. Select all that apply. 1. Polyuria. 2. Shakiness. 3. Palpitations. 4. Blurred vision. 5. Lightheadedness. 6. Fruity breath odor. Answer. 2. Shakiness. 3. Palpitations. 5. Lightheadedness. Rationale. Shakiness, palpitations, and lightheadedness are signs, symptoms of hypoglycemia and would indicate the need for food or glucose. Polyuria, blurred vision, and a fruity breath odor are manifestations of hyperglycemia. 19. The nurse provides instructions to a client newly diagnosed with type 1 diabetes mellitus. The nurse recognizes accurate understanding of measures to prevent diabetic ketoacidosis when the client makes which statement? 1. I will stop taking my insulin if I'm too sick to eat. 2. I will decrease my insulin dose during times of illness. 3. I will adjust my insulin dose according to the level of glucose in my urine. 4. I will notify my primary healthcare provider, PHCP, if my blood glucose level is higher than 250 mmol/L. Answer: 4. I will notify my primary healthcare provider, PHCP, if my blood glucose level is higher than 250 mmol/L. Rationale: during illness, the client with type 1 diabetes mellitus is at increased risk of diabetic ketoacidosis due to hyperglycemia associated with the stress response and due to a typically decreased caloric intake. As part of sick day management, the client with diabetes should monitor blood glucose levels and should notify the PHCP if the level is higher than 250 mg per deciliter, 13.9 mmol/L. Insulin should never be stopped. In fact, insulin may need to be increased during times of illness. Doses should not be adjusted without the PHCP's advice and are usually adjusted on the basis of blood glucose levels, not urinary glucose readings. 20. The nurse is monitoring a client newly diagnosed with diabetes mellitus for signs of complications. Which sign or symptom, if frequently exhibited in the client, indicates that the client is at risk for chronic complications of diabetes if the blood glucose is not adequately managed? 1. Polyuria. 2. Diaphoresis. 3. Pedal edema. 4. Decreased respiratory rate. Answer: 1. Polyuria. Rationale: chronic hyperglycemia, resulting from poor glycemic control, contributes to the microvascular and macrovascular complications of diabetes mellitus. Classic symptoms of hyperglycemia include polydipsia, polyuria, and polyphagia. Diaphoresis may occur in hypoglycemia. Hypoglycemia is an acute complication of diabetes mellitus, however. It does not predispose a client to the chronic complications of diabetes mellitus. Therefore, option 2 can be eliminated because this finding is characteristic of hypoglycemia. Options 3 and 4 are not associated with diabetes mellitus. 21. A client with diabetes mellitus demonstrates acute anxiety when admitted to the hospital for the treatment of hyperglycemia. What is the appropriate intervention to decrease the client's anxiety? 1. Administer a sedative. 2. Convey empathy, trust, and respect toward the client. 3. Ignore the signs and symptoms of anxiety, anticipating that they will soon disappear. 4. Make sure that the client is familiar with the correct medical terms to promote understanding of what is happening. Answer: 2. Convey empathy, trust, and respect toward the client. Rationale: anxiety is a subjective feeling of apprehension, uneasiness, or dread. The appropriate intervention is to address the client's feelings related to the anxiety. Administering a sedative is not the most appropriate intervention and does not address the source of the client's anxiety. The nurse should not ignore the client's anxious feelings. Anxiety needs to be managed before meaningful client education can occur. 22. The nurse is preparing a plan of care for a client with diabetes mellitus who has hyperglycemia. The nurse places priority on which client problem? 1. Lack of knowledge. 2. Inadequate fluid volume. 3. Compromised family coping. 4. Inadequate consumption of nutrients. Answer: 2. Inadequate fluid volume. Rationale: an increased blood glucose level will cause the kidneys to excrete the glucose in the urine. This glucose is accompanied by fluids and electrolytes, causing an osmotic diuresis leading to dehydration. This fluid loss must be replaced when it becomes severe. Options 1, 3, and 4 are not related specifically to the information in the question. 23. A young man with type 1 diabetes mellitus tells the nurse that he might lose his job because he has been having frequent hypoglycemic reactions. His boss thinks that he is drunk during these episodes and that he has been drinking on the job. Which action by the nurse would best assist this client to meet his needs? 1. Ask the client if he indeed has been drinking at work. 2. Ask the client what he does to treat his hypoglycemia. 3. Contact the local employment office to help him find another job. 4. Examine factors with the client that may be causing frequent hypoglycemic episodes. Answer. 4. Examine factors with the client that may be causing frequent hypoglycemic episodes. Rationale. Hypoglycemic reactions present as adrenergic symptoms of tremor, shakiness, and nervousness that are comparable or alike to the signs of alcohol intoxication. The best strategy to assist the client to meet his needs is to decrease the episodes of hypoglycemia by first identifying and then eliminating those factors that precipitate this event. Asking the client if he has been drinking at work and contacting the local employment office are inappropriate. Asking the client what he does to treat his hypoglycemia is not directly related to the subject, factors that may cause frequent hypoglycemic episodes. 24. The home health nurse visits a client with a diagnosis of type 1 diabetes mellitus. The client reports a history of vomiting and diarrhea and tells the nurse that no food has been consumed for the last 24 hours. Which additional statement by the client indicates a need for further teaching? 1. I need to stop my insulin. 2. I need to increase my fluid intake. 3. I need to monitor my blood glucose every 3 to 4 hours. 4. I need to call my primary healthcare provider, PHCP, because of these symptoms. Answer. 1. I need to stop my insulin. Rationale. When a client with diabetes mellitus is unable to eat normally because of illness, the client still should take the prescribed insulin or oral medication. The client should consume additional fluids and should notify the PHCP. The client should monitor the blood glucose level every 3 to 4 hours. The client should also monitor the urine for ketones during illness. 25. The nurse is caring for a client after hypophysectomy and notes clear nasal drainage from the client's nostril. The nurse should take which initial action? 1. Lower the head of the bed. 2. Test the drainage for glucose. 3. Obtain a culture of the drainage. 4. Continue to observe the drainage. Answer. 2. Test the drainage for glucose. Rationale. After hypophysectomy, the client should be monitored for rhinorrhea, which could indicate a cerebrospinal fluid leak. If this occurs, the drainage should be collected and tested for the presence of cerebrospinal fluid. Cerebrospinal fluid contains glucose, and if positive, this would indicate that the drainage is cerebrospinal fluid. The head of the bed should remain elevated to prevent increased intracranial pressure. Clear nasal drainage would not indicate the need for a culture. Continuing to observe the drainage without taking action could result in a serious complication. 26. The nurse is trying to communicate with a client who had a stroke and has aphasia. Which actions by the nurse would be most helpful to the client? Select all that apply. 1. Speaking to the client at a slower rate. 2. Allowing plenty of time for the client to respond. 3. Completing the sentences that the client cannot finish. 4. Looking directly at the client during attempts at speech. 5. Shouting words if it seems as though the client has difficulty understanding. Answer. 1. Speaking to the client at a slower rate. 2. allowing plenty of time for the client to respond. 4. Looking directly at the client during attempts at speech rationale. Clients with aphasia after brain attack often fatigue easily and have a short attention span. General guidelines when trying to communicate with the aphasic client include speaking more slowly and allowing adequate response time, listening to and watching attempts to communicate, and trying to put the client at ease with a caring and understanding manner. The nurse would avoid shouting, because the client is not deaf, appearing rushed for a response, and letting family members provide all responses for the client. 27. The nurse is preparing a list of home care instructions for a client who has been hospitalized and treated for tuberculosis. Which instructions should the nurse include on the list? Select all that apply. 1. Activities should be resumed gradually. 2. Avoid contact with other individuals, except family members, for at least 6 months. 3. A sputum culture is needed every 2 to 4 weeks once medication therapy is initiated. 4. Respiratory isolation is not necessary because family members already have been exposed. 5. Cover the mouth and nose when coughing or sneezing and put used tissues in plastic bags. 6. When one sputum culture is negative, the client is no longer considered infectious and usually can return to former employment. Answer. 1. Activities should be resumed gradually. 3. A sputum culture is needed every 2 to 4 weeks once medication therapy is initiated. 4. Respiratory isolation is not necessary because family members already have been exposed. 5. Cover the mouth and nose when coughing or sneezing and put used tissues in plastic bags. Rationale. The nurse should provide the client and family with information about tuberculosis and allay concerns about the contagious aspect of the infection. The client needs to follow the medication regimen exactly as prescribed and always have a supply of the medication on hand. Side and adverse effects of the medication and ways of minimizing them to ensure compliance should be explained. After 2 to 3 weeks of medication therapy, it is unlikely that the client will infect anyone. Activities should be resumed gradually and a well-balanced diet that is rich in iron, protein, and vitamin C to promote healing and prevent recurrence of infection should be consumed. Respiratory isolation is not necessary because family members already have been exposed. Instruct the client about thorough handwashing, to cover the mouth and nose when coughing or sneezing, and to put used tissues into plastic bags. A sputum culture is needed every 2 to 4 weeks once medication therapy is initiated. When the results of 3 sputum cultures are negative, the client is no longer considered infectious and can usually return to former employment. 28. A client with a medical diagnosis of breast cancer is undergoing chemotherapy. The client complains to the nurse about losing her hair and severe fatigue from the treatment. Which interventions should the nurse implement for this client? Select all that apply. 1. Review side effects of chemotherapy and treatment with the client. 2. Teach the client how to resolve specific concerns of her personal life. 3. Teach the client to pace activities with rest so as to maintain strength. 4. Offer information on available counseling services and support groups. 5. Tell the client about some other clients who have had breast cancer treatment. 6. Inquire how the cancer diagnosis and treatment affect the client's normal routine. Answer. 1. Review side effects of chemotherapy and treatment with the client. 3. Teach the client to pace activities with rest so as to maintain strength. 4. Offer information on available counseling services and support groups. 6. Inquire how the cancer diagnosis and treatment affect the client's normal routine. Rationale. It is not therapeutic, nor is it the nurse's role to teach the client how to resolve specific concerns of her personal life. The nurse should determine how the cancer diagnosis and treatment are affecting the client's normal routine. And the client should be aware of potential side effects of treatment so as to cope with the events with medications or other measures. It is important for the nurse to inform clients about support groups available, e.g., Reach for Recovery, so the client does not feel isolated. Teaching clients to pace activities even when they feel well will conserve energy so they ultimately feel stronger and less fatigued. It is a breach of confidentiality in the Health Insurance Portability and Accountability Act, HIPAA, laws for the nurse to discuss other clients and their medical problems. 29. The nurse is reviewing the laboratory test results for a client receiving chemotherapy. The nurse notes that the white blood cell count is extremely low and places the client on neutropenic precautions. Which interventions are components of these types of precautions? Select all that apply. 1. Allowing only fresh fruits in the client's room. 2. Removing fresh cut flowers from the client's room. 3. Encouraging the client to eat any types of fresh vegetables. 4. Instructing family members on the proper technique for handwashing. 5. Instructing family members to wear a mask when entering the client's room. Answer. 2. Removing fresh cut flowers from the client's room. 4. Instructing family members on the proper technique for handwashing. 5. Instructing family members to wear a mask when entering the client's room. Rationale. In the immunocompromised client, a low bacteria diet is necessary. This includes avoiding the intake of fresh fruits and vegetables. Thorough cooking of all food also is required. Cut flowers and any standing water are removed from the room because both tend to harbor bacteria. Anyone who enters the client's room should perform strict and thorough handwashing and wear a mask. 30. The nurse caring for a male client newly admitted to the hospital with a diagnosis of pneumonia suspects that the client is also at risk for metabolic syndrome if which characteristics have been identified in this client? Select all that apply. 1. Hemoglobin A1C of 6.5%. 2. Waist circumference of 36 inches. 3. Triglycerides 160 mg per deciliter, 1.81 mmol/L. 4. Consistent systolic blood pressures less than 130 mm Hg. 5. Serial fasting glucose levels of 120 mg per deciliter, 6.85 mmol/L, 132 mg per deciliter, 7.54 mmol/L, and 128 mg per deciliter, 7.31 mmol/L. Answer. 1. Hemoglobin A1C of 6.5%. 3. Triglycerides 160 mg per deciliter, 1.81 mmol/L. 5. Serial fasting glucose levels of 120 mg per deciliter, 6.85 mmol/L, 132 mg per deciliter, 7.54 mmol/L, and 128 mg per deciliter, 7.31 mmol/L. Rationale. Features of metabolic syndrome include abdominal obesity, waist circumference of 40 inches, 100 centimeters, or more for men, hyperglycemia, fasting blood glucose level of 110 mg per deciliter, 6 mmol/L, or more, or on medication treatment for elevated glucose, abnormal hemoglobin A1C, greater than 6.0%, hypertension, systolic blood pressure of 130 mm Hg or more, or diastolic blood pressure of 85 mm Hg or more, or on medication treatment for hypertension, hyperlipidemia, triglyceride level of 160 mg per deciliter or more, or on medication treatment for elevated triglycerides. Normal triglycerides is 40 to 160 mg per deciliter, 0.45 to 1.81 mmol/L. High-density lipoprotein cholesterol less than 40 mg per deciliter for men. Normal is greater than 40 mg per deciliter, greater than 1.55 mmol/L. The client's risk factors include elevated triglyceride level, elevated hemoglobin A1C, and elevated fasting blood glucose levels.